Hey folks, Dr. Glenn Gata here, and what we're here to talk about today is thyroid problems. A lot of patients will come in and they'll be on different thyroid medicine. Their labs will be normal, but they're still experiencing the symptoms of a thyroid issue. Some of the common symptoms are weight gain, fatigue, hair loss. And a lot of these patients are asking questions on why they still experience these problems if they're on the medicine they should be on and if their labs are normal. So in order to understand the possibilities of why we're still experiencing thyroid symptoms, it's important to start out to understand how the thyroid actually works. The first thing that happens is there's an area of our brain called our hypothalamus, and that actually releases thyroid releasing hormone. That hormone goes to another area of your brain called your pituitary. The pituitary releases thyroid stimulating hormone, which a lot of people are familiar with. Then that goes to the thyroid, which releases your T3 and T4. That area of your brain, your hypothalamus and your pituitary, is very sensitive to inflammation. And if there's a lot of chronic systemic inflammation in your body, that area literally doesn't work the way that it should. So if we're experiencing inflammation, we need to try to get to why we're having inflammation. Why are we chronically inflamed with issues that are altering the brain, which alters the thyroid function? Some of the common problems that we deal with in chronic inflammation are food sensitivities. People are sensitive to different foods. That creates inflammation. It creates chemicals that actually go to that part of the brain and alter the function of it. Another is bad blood sugar. When our blood sugar is not regulated the right way, that creates inflammation. An anti-inflammatory diet is what people need to be on. Most of the standard American diet is a lot of inflammatory foods that create chronic problems as well. And an autoimmune disease. People that have a chronic autoimmune disease, which is actually the #1 reason of a thyroid problem, creates a lot of inflammation as well. So it's a complex thing that occurs with your thyroid, and typically there's not one answer or solution. We have to look at what's causing the inflammation in order to get it under control. We'll be doing a lecture at the office this Wednesday. The information is listed below. If you'd like more information and come to the lecture, just please call the office and we'll set you up and we'll talk more about this topic.